choosing a therapy in any condition obviously involves weighing efficacy and safety. For migraine, different treatment options have different attributes. And broadly speaking, all the available drugs are quite safe, but they differ in tolerability. So, for example, the injectable formulation of sumatriptan, which is available in several doses, has very rapid onset of action and is really quite effective, but it produces more nuisance side effects than sumatriptan given through other routes. So you're more likely with injectable sumatriptan to feel flushing, tingling, in some cases a chest pressure sensation, which is frightening in a drug that does constrict blood vessels and has a very small amount, but a real amount of cardiovascular liability. The other issue is we often talk about what treatment to start, but I think it's important for physicians to recognize that when we see patients for migraine in primary care or specialty care settings, the patient is already using some acute treatment in the overwhelming majority of cases. So it's important to determine what the patient is using and what they've used in the past and what their unmet treatment needs might be. So if a patient's unmet treatment need is that they want something that works quickly, considering an injectable or a nasal spray is an important option. If a patient wants a drug that's likely to deliver greater tolerability, there are two triptans that are more tolerable than the others, naratriptan and amitriptan, and those are good choices. If the patient's problem is they take the acute treatment, it works quickly, but then their headache comes back from 2 to 24 hours later, that's a phenomenon called headache relapse or sometimes headache recurrence. And for those patients, it might be best to give a drug with a longer half-life, like elatriptan as an example. So the choice, and then patients have different preferences in terms of how important is speed versus how important is freedom from side effects. So knowing the alternatives and matching the treatment to the patient's treatment need and treatment experience, I think, is the key to getting treatment right.
Many of the side effects associated with triptans are distinct to the individual triptan. So, for example, sumatriptan injectable has more side effects than oral, and some of the other triptans, like naratriptan, have less side effects. So you can switch from one triptan to another, switch from an injectable to an oral tablet, and then figure out what is the side effect and try to find something to help. Now, many people take a triptan in combination with a nonsteroidal, they get better results and perhaps a few less side effects.